I'm Trinity.
And I'm Sadie.
And today we're going to be talking about joints. With one exception, every bone in the body forms a joint with at least another bone. Articulations have two functions. They hold the bone together securely, but they also give the rigid skeleton mobility. Joints are classified in two ways, functionally and structurally. The function class is the amount of movement by the joint. The structure class includes fibrous, cartilaginous, and synovial joints. Fibrous joints are immovable, cartilaginous joints are slightly movable, and synovial joints are freely movable.
Although bones have remarkable self-regenerative powers, some conditions are just too severe for bones to repair. For example, extensive shattering. Did you know electrical stimulation of fracture sites increases the speed and completeness of healing fractures? Do you know if electricity promotes healing, Trinity?
I have no idea.
Yeah, I didn't think so. But one theory is native fields prevent parathyroid hormone from stimulating the bone-absorbing osteoclast cells at the fracture site. Ultrasounds introduce a basis of an image technique. The most troublesome injuries to bones are non-union fracture. A non-union fracture is a two-part of a split bone that failed to join. Fractures like this are normally treated with grafts. Grafting is when sections of bones are taken from the hip and inserted into the gap. Did you know 1/3 of grafts fail to heal?
I had no idea.
A potential improvement is the free vascular fibular graft technique. This technique uses pieces of the fibula to replace missing bone. One reason bone grafts fail is because blood supply cannot reach their interior.
Fibrous joints and sutures are irregular edges of the bones that interlock and bind tightly together by connective tissue fibers allowing no movement. Synemosis is the connecting fibers that are longer than the sutures. This means the joint has more to give. Examples of synemosis is the joint connecting distal ends of the tibia and fibula. Cartilaginous joints are the bone ends that are connected by cartilage. For example, they are slightly movable and the pubic symphysis of the pelvis and the invertebral joints of the spinal column, where the articulating bone surfaces are connected by pads of fibrocartilage. The cartilaginous joints between the first ribs and the sternum are immovable.
Synovial joints are those in which the articulating bone ends are separated by a joint cavity containing synovial fluid. This accounts for all joints of the limbs. The joint surfaces are enclosed by a sleeve or capsule of fibrous connective tissue, and the capsule is lined with a smooth synovial membrane. This is the reason they are called synovial joints. The articular capsule encloses a cavity called the joint cavity, which contains lubricating synovial fluid. Bursae and tendon sheaths are not strictly part of the synovial joints, but they are often found closely associated with them. Bursae are flattened fibrous sacs lined with synovial membrane and containing a thin film of synovial fluid. They are common where ligaments, muscles, skin, and tendons or bone rub together. A tendon sheath is essentially an elongated bursae that wraps completely around a tendon subjected to friction.
The shapes of articulating bone surfaces determine what movements are allowed in a joint. Synovial joints can be classified as plain, hinge, pivot, condyloid, saddle, and ball and socket joints.
Plain joints have an essentially flat articular surface. Only short slipping or gliding movements are allowed. Movements of plain joints are non-axial. Non-axial means that gliding doesn't involve rotation around an axis.
A hinge joint is formed when a cylindrical end of a bone fits into a trough-shaped surface. In a hinge joint, angular movement is allowed, for example, elbow and ankle joints, and the joints between the phalanges. This type of joint is classified as uniaxial, which means it only allows movement around one axis.
Pivot joints occur when the rounded end of one bone fits into a sleeve or ring of a bone. Pivot joints are also uniaxial. An example of the proximal radial-ulnar joint and joint between the atlas and the condyloid joints are egg-shaped. The articular surface of one bone fits into an oval concavity in another. Condyloid joints allow the moving bone to travel from side to side and back and forth, but the bone cannot rotate around its long axis.
Saddle joints are when each articular surface has both concave and convex areas like a saddle. The biaxial joints are the carpometacarpal joints in the thumb, and the movements of the joints are clearly demonstrated by twiddling your thumbs.
A ball and socket joint is formed when the spherical head of one bone fits into a round socket of another. Multi-axial joints allow movement in all axes, including rotation, and are the most freely moving synovial joints. Examples are your shoulders and your hips. Sprains and dislocations are other types of joint problems that result in swelling or pain. A sprain is the ligaments reinforcing a joint that is damaged by excessive stretching or is torn from the bone. Sprains heal slowly. Few inflammatory joint disorders cause more pain and suffering than arthritis. If you didn't know what arthritis is, it is a worldwide spread crippling disease in the United States. Acute arthritis is a bacterial invasion and are treated with antibiotic drugs. Osteoarthritis is the most common form of arthritis, which is a chronic degenerative condition that typically affects the aged. This type of arthritis is also known as wear and tear arthritis, which affects the articular cartilages. As this disease progresses, the exposed bone thickens and extra bone tissue called bone spurs grows around the margins, and the eroded cartilage restricts the joint movement. Osteoarthritis is slow and irreversible.
Rheumatoid arthritis is a chronic inflammatory disorder in which the body's immune system attempts to destroy its own tissue. This type of arthritis begins with inflammation of the synovial membranes. Membranes thicken and the joints swell as synovial fluid accumulates. Therapy for RA involves many different types of drugs. Gouty arthritis is a disease in which uric acid accumulates in the blood and may be deposited as needle-sharp crystals in the soft tissues of joints, lead to an agonizingly painful attack that typically affects a joint. Gout is destructive and the bone ends fuse and the joint becomes immobilized.